this has been a week of no jawbone. When you say no jawbone, here is classic case number of the week. Patient comes in with a panoramic X-ray, and you can see the 3D X-ray that there is minimal bone. I mean, like paper thin bone, paper thin. Where are we going to put the implant? If you just look at the 3D, just look at the 2D panel. 2D panel looks actually decent. There's a lot of bone, but if you unveil, I'm just going to show the upper. It's like a knife. We call it a knife edge ridge. The bone has resorbed. The bone has shrunk so much. How are you going to put the implant? So look what we did. And this is where I was able to get 5 implants on the top, 4 on the bottom. And I want to show that, look, even with very thin bone, we were able to really expand that bone very slowly. So patient didn't need an additional bone grafting surgery. Patient didn't need to go through extensive, sinus lift. But I was able to very, very meticulously expand the bone and place the implants right in the middle, in the triangle of bone, to give patients a full set of functioning teeth with implants on the top, implants on the bottom. We're just showing that patients come to us with very little bone. And even in these situations, we're able to navigate very slowly and place 5 implants on the top, 4 on the bottom. And this will show, no, that's another case. We're just going to show that how we're able to expand the bone and place the implants and still give a good outcome. Case number 2, the second case of the week, is this one. I'm going to show this one. If you really look at it, patient has only 4 teeth left here, very few teeth left. The lower is pretty straightforward, but the upper, there's these sinuses. What are you going to do? Patient told she needed a sinus lift. Patient thought the sinus grafting was going to be done. So we sort of navigated differently. So the way I approached this case earlier this week was I was able to get 5 implants. Actually, 6 on the top. I had to end up doing what we call a zygomatic implant. Zygomatic implant is a long implant that goes in your cheekbone because there was no bone here. So I had to put a long implant on this without doing any kind of sinus lift. And then we put 4 on the bottom. So take a look. We did all on 4 on the bottom, and we were able to put in 6 implants, including 1 zygomatic implant for this patient that previously told that she was not a candidate for implants. So the message here is that your patients are going to be told they don't have enough bone, they need sinus lift, they need bone grafting. For some patients, that might be true, but we're able to navigate these challenging cases that traditionally would require multiple surgeries in one surgical visit with either bone expansion, using narrow diameter implants, but still getting good quality torque, we call it fixation on those implants, or using zygomatic implants that we could not do with the regular implant, and still provide patients with fixed, non-removable teeth that they can leave on the day of the surgery versus just a piece of plastic. That's the danger. So we termed it, we coined it, we trademarked it, we call it the no jawbone solution. The no jawbone solution is actually one of our terms that we have used, and we have trademarked it. It's actually a federal trademark, and we like to call it no jawbone solution because we have several ways of doing the no jawbone solution. Specifically when it comes to the upper jaw for patients that traditionally would require bone grafting, sinus lift, or traditional approaches that would take multiple surgeries, would be